COVID-19 pandemic doesn't affect people only during the active infection. It seems to affect people even after they've recovered. And some of these post-COVID effects can last a very long time. In fact, the term long COVID is given to people with this problem. And it seems to affect every single organ system in the body. Starting with the lungs, which it starts affecting, it can leave a person feeling breathless, having a persistent cough, and also in the long term in a few can cause what is called post-COVID lung fibrosis. But it's not only the lungs that get affected, it can also affect other systems. One of the most common problems that post-COVID patients complain about is feeling extremely anxious, having palpitations, and feeling very fatigued. Even the smallest action can leave them fatigued for a long time, and this seems to go on sometimes for a few months after they've recovered from the acute COVID infection. It also seems to affect other systems, sometimes pretty drastically, including the neurological system. And what's worrying is it's not only people who've had severe COVID infection who seem to have this problem, it's also people who sometimes have recovered from a fairly mild disease, practically asymptomatic, but then weeks later continue to complain of feeling tired, having difficulties in concentration, losing memory, and so on.
People who recover from COVID-19, a lot of them tend to have residual complaints that are not only respiratory in nature, but also affect the cardiovascular, neurological, and musculoskeletal systems. As a result of this, they may have residual weakness that is either focal or generalized, pain that might be related to nerve damage, and fatigue, along with probable cognitive and mood issues. As a result of these impairments, they may have difficulties in performing their day-to-day tasks and have a significantly reduced physical activity performance.
So we've started a clinic to look after patients who have these post-COVID problems. We call it the Post-Covid Rehabilitation Clinic or the Post-Covid Care Center. We are located at Narayana Hospital in the basement of the International Wing, and we have a multidisciplinary team to take care of people with this problem. A physician, a pulmonologist, a physical medicine expert, a physiotherapy, occupational therapy departments, a psychiatrist and a psychologist, as well as nutrition experts, all of whom together will help people who have this problem overcome it. So please make use of this service that we are offering so that you can get over these symptoms completely, because all these, while they last for a long time, are completely reversible, and reversible even more quickly with appropriate help from the specialists. So reminding you of the post-COVID problems and the fact that the post-COVID clinic can help you get better faster if you're unfortunate enough to have this problem.
What would benefit these patients is a thorough functional status assessment and physical performance assessment done by the physicians or the rehab physician. And then these patients are taken through a program focused on physical therapy, occupational therapy, yoga and respiratory therapy. And we also have a dietitian on board who customizes an individualized dietary program for these patients. Each member of this team has a specific role. A physical therapist focuses on muscle strength, aerobic endurance, and respiratory function. An occupational therapist focuses on activities of daily living, helps the patient pace their day-to-day tasks, and also focuses on energy conservation measures. The yoga therapist has devised an individualized program for COVID patients focusing on certain pranayamas and asanas. The respiratory therapist would help with individualized breathing programs for people who have isolated residual breathing difficulty and cough. Through all these measures, we seek to add quality of life to our patients, because not only is it important to add years to life, but we also need to add life to those years.
Timely nutritional support after COVID-19 infection is very important, because there will be severe weakness of body due to muscle loss, impaired immunity, and higher chances of acquiring other infections. So it is important to eat foods that provide nutrients to rebuild your muscles, boost immune system, and increase energy levels. To achieve this nutritional care, one of the most important thing we must do is keep yourself well hydrated, drink plenty of water, include fluids like coconut water, buttermilk, dal and vegetable soups, eat food rich in protein and adequate calories. It will help us to recover fast, and consume vitamins and minerals rich foods. Include healthy carbohydrates, not simple ones like sugary and carbonated drinks. Eat energy dense foods and have proper sleep and rest. Stick with fresh, simple home cooked meals. Please get yourself evaluated periodically with a team of qualified medical and nutrition experts. We at Narayana Health here to guide you regarding your nutritional part and make your individualized meal plan based on your clinical conditions.